Hi everyone. Today we'll be presenting on osteoarthritis. Osteoarthritis, often abbreviated as OA, is one of the most common joint condition people experience. This presentation is done by Tracy, Ludmila, and Zifong. Osteoarthritis, or OA, is the most common type of arthritis. It develops when the smooth cartilage that normally cushions our joints wears down. Without this protective layer, the bone wrapped together, which leads to discomfort, limited movement, and joint changes. OA is considered a non-inflammatory condition, and it's often called wear and tear arthritis or degenerative joint disease. The joint most often affected include the knees, hip, hands, neck, and lower back. Osteoarthritis is a long-term joint disease. Over time, the cartilage inside of the joint gradually breaks down. As that cartilage is lost, the bone starts to grind against each other. This can cause pain, stiffness, swelling, and limited movement. OA cannot be cured, but with the right management, symptoms can be controlled and people can maintain their mobility and quality of life. Osteoarthritis is very common. About 33 million adults in the United States live with it, although it's more likely to appear after age 45 or 55, and it's not simply a disease of aging. Women are more often affected than men, especially after menopause. Young adults and athletes can also develop OA, usually after joint injuries or years of high impact sports. High risk is higher for people with obesity, diabetes, high cholesterol, or other joint conditions. This shows that OA can affect a wide range of people. The cause of OA are grouped into primary and secondary. Primary causes include natural aging, everyday wear and tear of joints, repetitive stress, and family history. Secondary causes include joint injuries from accidents or sports, obesity that adds extra pressure to the joints, metabolic conditions like diabetes, and hormonal changes such as those during menopause. Together, these factors increase the risk of cartilage breakdown and development of OA.
You might be asking yourself, how is osteoarthritis diagnosed? Good question. It starts with an examination by your doctor. Your doctor will most likely ask you about your symptoms, medical history, and if you have any family history of joint disorders. Then, your doctor will probably take a look at your bothersome joint, checking it for abnormalities in appearance or flexibility, as well as tenderness or swelling. From there, your doctor may need to order some tests. One test they might order is an x-ray. While cartilage cannot be seen on an x-ray, if you have osteoarthritis, a narrowing of the space between the bones in the joints will likely show up. X-rays will also show bone spurs, which are extra bits of bones that can form around the joints affected by osteoarthritis. Another less commonly ordered test your doctor might consider is an MRI. An MRI shows a detailed image of the bones, soft tissue, including the cartilage. An MRI isn't usually needed to diagnose osteoarthritis, but it can be helpful in providing more information in more complicated cases. Your doctor might also order some blood work from you. There isn't a blood test that can detect osteoarthritis, but other joint disorders like rheumatoid arthritis can be ruled out. Another test your doctor may consider is a joint fluid analysis. For this test, a sample of the synovial fluid in your affected joint will be collected using a needle. Then the fluid will be tested to determine if your pain is from an inflammatory disorder like gout or RA, or is in fact from osteoarthritis. Signs and symptoms. Osteoarthritis symptoms are usually localized in the affected joint, and they don't typically affect the rest of the body. If you have OA, you probably have some pain. The affected joint might hurt during or after movement. You might also experience some stiffness. Joint stiffness will most likely be noticeable when you wake up or after long periods of inactivity. With OA, you might experience some tenderness. Joints might feel tender when a light pressure is applied to them or around them. You might also have a decline in flexibility and not be able to move your joint through its full range of motion. You might even experience a grating sensation. When you use the joint, you might hear a popping or a crackling. If you have osteoarthritis, you may feel or see bone spurs. They feel like hard lumps around the affected joint. And lastly, you might have some swelling from inflammation around the joint. There are several management options for osteoarthritis depending on the severity. The first thing you should do if you think you have OA or if you have persistent joint pain is go see a doctor. From there, you may consider medications, treatment with a TENS unit, physical or occupational therapy, injections into the affected joint, or even surgical procedures. Some medications you and your doctor might discuss are over the counter, like Tylenol, Motrin, or Aleve. The purpose of these medications is to reduce pain as well as inflammation. Your doctor might also prescribe some medications. Cymbalta is commonly prescribed off-label for pain related to osteoarthritis. You might consider some topical medications. These are medications you apply directly to the affected joint, like Voltaren, Bengay, or Aspercreme. Beyond medications, treatment with a TENS unit could be an option. TENS, or transcutaneous electrical nerve stimulation, uses a low voltage electrical current to relieve pain. It provides short-term relief for many people with osteoarthritis of the knees or hip. Some people even get injections of cortisone or lubricating jelly directly into the joints for pain relief. And finally, you and your doctor may wish to consider surgical options, which we'll discuss in a moment.
Diet is an important part of managing osteoarthritis. Eating a balanced diet with plenty of fruit, vegetables, and whole grains provides vitamins, minerals, and antioxidants that support joint health. A Mediterranean-style diet, which emphasizes foods like fish, olive oil, nuts, and fresh produce, helps reduce inflammation and joint discomfort. Adequate protein is essential to maintain muscle strength, which supports the joints and improves mobility. It's also important to limit processed foods, sugar, alcohol, and excessive red meat, as these can contribute to inflammation. Finally, getting enough calcium and vitamin D helps keep bones strong, which is vital for overall joint support and long-term bone health. When osteoarthritis progresses and conservative treatments like medications or physical therapy no longer provide relief, surgery may be needed. Arthroscopy is a minimally invasive procedure where a small camera and tools are inserted into the joint to clean out loose cartilage or bone fragments. Osteotomy is a bone cutting surgery, usually in younger patients, where the surgeon realigns the bones around the joint to shift weight away from the damaged area. A partial arthroplasty replaces only one part of the joint, such as the inner or outer side of the knee, which preserves more of the natural joint. Finally, the gold standard is total joint arthroplasty, also known as a total hip or knee replacement, where the entire joint surface is replaced with artificial components to provide lasting pain relief and improved mobility. After osteoarthritis surgery, the focus is on helping patients recover safely and regain function. Early mobilization and physical therapy are important to improve joint movement, strength, and prevent stiffness. Pain management includes medications and non-drug approaches like ice or heat therapy. Preventing complications such as infection, blood clots, or joint dislocation is essential. At home, patients may need fall prevention strategies and assistive devices like walkers or grab bars. Long-term, maintaining regular exercise and a healthy lifestyle supports joint health and helps preserve the results of the surgery. There are many resources to help patients living with osteoarthritis. Nationally, the Arthritis Foundation offers education, exercise programs, and support groups. The National Institute of Arthritis and Musculoskeletal Disorders provide reliable patient education and research updates. Locally in San Joaquin County, patients can access arthritis and orthopedic services at St. Joseph Medical Center and the Dameron Hospital. The San Joaquin County Public Health Services also provide community-based health programs and referrals. Here are the references that we use for our topic today. Thank you for your watching.